Welcome to the second session of the teleconferencing. We were discussing about the assessment and classification of the older child. Before the tea break, we discussed about the general danger sign. Then we discussed how to assess the cough and difficult breathing. You saw the video. Now we will discuss in detail how actually you will assess and classify. Now we will request Dr. Prasad to tell us how the students will proceed with the assessment classification of cough and difficult breathing. Dr. Prasad, please.
Thank you, Dr. Jaina. General danger sign you have already done, and do not forget about this. If it is present, it will help in classification of subsequent symptomatology also. So that you should keep in mind. Now, so far as cough or difficult breathing is concerned, first question is definitely you ask the mother if the child has got cough or difficult breathing. If yes, then ask how long this cough is present. Then count the breath in complete 1 minute and decide if fast breathing is there or not. If you remember, you have seen the video how to count the breathing, and you have also seen the cutoff points that 2 months up to 12 months, if it is 50 or more, this is fast breathing, and 12 months up to 5 years, if it is 40 or more, it is fast breathing. So once you have decided it is fast breathing or not, second thing is you have to look for the chest indrawing, and third is you have to look and listen for the stridor. Once you have done this thing, then you get the signs, and we come to the classification. In classification, whenever we start classifying, we always try to look for the signs in red row first. So first point, you will notice that it is any general danger sign. So if any one, at least one, it could be more than one also, if a general danger sign is present, or chest indrawing is present, or stridor is present, then the classification is severe pneumonia or very severe disease in the pink row. If you don't get any of these signs, come down to the yellow row and try to see if fast breathing is present. If fast breathing is present, then the classification is pneumonia. And if there are no signs of either pink or yellow, you come down, and then the classification is very simple. It is no pneumonia, cough or cold. So the classification of cough or difficult breathing is very simple. Dr. Jaina.
Yeah. Thank you, Dr. Prasad, for telling us how to classify the cough and difficult breathing. As you know, in the series of the assessment, after cough and difficult breathing comes the whether the child is having the diarrhea. So assessment of diarrhea will be discussed now by Dr. Ramji. Dr. Ramji, can you tell us how to proceed with assessment of diarrhea?
Yeah, thank you, Dr. Jaina. Students, we have gone through the first main box just now with Dr. Prasad, that is how to assess for cough and difficult breathing. The second main symptom which we have to ask the mother or the care provider is whether the child has diarrhea, and obviously we enter the box only if the mother states that there is diarrhea. If there is no diarrhea, obviously we'll go beyond to the next symptom. So before we discuss how to make the assessment, let's have a very quick look at the video clipping of how to look at make an assessment for diarrhea, and then we look at the differences of how this assessment is different from the young infant, and then look at the classification of this entity. So can we have the video clipping first?
Main symptom of diarrhea. Ask,
does the child have diarrhea?
if the mother says yes, assess the child further. Ask,
For how long?
the number of days determines whether the child has persistent diarrhea. Next, ask,
Is there blood in the stool?
blood in the stool is a sign of dysentery. Then every child with diarrhea is assessed for signs of dehydration. To assess a child for dehydration, Look at the child's general condition. Decide, is the child lethargic or unconscious? Is the child restless and irritable? You will now see examples of these signs.
This child is very ill. His general condition could be described as unconscious. This child's condition could best be described as restless and irritable. This child appears well and alert. He is attentive and interested in what is going on around him. He is not lethargic. He is not restless or irritable.
Look at the child's eyes.
This child's eyes are definitely sunken. This child has eyes which are sunken. If you're not sure if a child's eyes are sunken, you should ask the mother whether the child's eyes look unusual to her. This child's eyes appear normal. They are not sunken.
Offer the child fluid. Is the child not able to drink or drinking poorly? Is he drinking eagerly, thirsty, or does he drink normally?
This child is not able to drink at all. This child is obviously thirsty and drinks eagerly. Often the thirsty child grabs for the spoon or cup. This child is drinking normally. He is not thirsty.
Pinch the skin of the abdomen. Does it go back very slowly, taking longer than 2 seconds? Does it go back slowly, or does it go back immediately? To correctly assess dehydration, consider each of these signs and use them to classify the child as having severe dehydration, some dehydration, or no dehydration. Now, let's assess this child with diarrhea. The mother has told us this child has diarrhea.
For how long?
She replies, for 3 days.
Is there blood in the stool?
There is no blood in the stool. His general condition could be described as restless and irritable if the child remains like this throughout the assessment. His eyes appear sunken. When offered a drink, he drinks eagerly. He is clearly very thirsty. When his skin is pinched, it goes back into place slowly. Now, let's see how the child's signs relate to the classification chart. Start with the top, pink row. He is not lethargic or unconscious. His eyes are sunken. He does not have the sign not able to drink or drinking poorly. His skin pinch does not go back very slowly. To classify the child as severely dehydrated requires 2 signs in this row. This child has only 1. So we move down to the middle row. Does the child have 2 or more of the signs needed to classify him as having some dehydration? His general condition is restless and irritable. His eyes are sunken. He is thirsty and drinks eagerly. His skin went back slowly. This child has more than 2 signs of some dehydration. Therefore, this child is classified as diarrhea with some dehydration. He does not have persistent diarrhea or dysentery.
We just saw a video clipping which I think was very clear. Not only did it show you how to do the assessment, but I think there was a very nice example of a child with diarrhea and dehydration which went through the process. But I think it's important for us to understand whether this process is entirely identical for the young infant. There are some subtle differences, and I think we would like to look at that at this moment. So could we project the assessment process to see how the assessment in the older child is different from the young infant. You may recollect that we assessed the young infant only using 3 signs. But here we have a 4th sign, and the 4th sign happens to be offering fluids. So this is a very important difference. So in the young infant we had just 3 when we looked at the general condition of the child. We had looked at the sunken eyes and we had looked at the abdomen, but the 4th additional sign that we now have is offering fluid. So please remember that this is one important difference. The point I wish to make here is that this offering fluid and assessing the child's ability to drink is a sign. So please remember, I have often seen students trying to use this as a historical information by asking the mother, how does the child drink? Please remember that this is a sign that has to be elicited by you by offering fluid. The second important thing is that as far as possible you should be offering ORS to this child to make the assessment, because a thirsty child really needs not only fluid but also needs the salt and sugar. So really, to elicit the sign correctly, remember, offer ORS to the older child and then make the assessment. As in the young infant, every child with diarrhea has to be assessed for dehydration, as we saw in the video clipping. And second, if they have diarrhea for more than 14 days, we have to assess them for persistent diarrhea. And thirdly, if there's blood in the stool, you may also have to assess this child for dysentery. So let's see, just to recap, we have already done this exercise in the video clipping. Remember that when we looked at the assessment for cough or difficult breathing, we need only 1 sign in the box. Here, remember, we need at least 2 of the 4 signs. And we saw that example, that if any 2 of the 4 are present, we have a severe dehydration. Similarly, coming to the yellow, if you have 2 of the 4, you say some dehydration. If you have neither, you have insufficient signs, we say the child is not dehydrated. So this is something that has to be done for all of them. The next one is actually looking at the issue of the child having persistent diarrhea. So if a child has diarrhea for more than 14 days or more, we would need to classify this child for persistent diarrhea. And lastly, of course, if the child has blood in stools, then the child has to be classified for dysentery. That means a child with diarrhea could have up to 3 classifications. 1 for the dehydration, 1 for the persistent diarrhea, and maybe 1 for the dysentery. So friends, this is a little different from the way we looked at cough or difficult breathing, where you're going to have only 1 classification, but diarrhea has, every child would have for dehydration, but in addition, 2 additional classifications may be present based on duration and the presence of blood. We will now kind of move on to the third main symptom. We have looked at two symptoms, that was cough, difficult breathing, diarrhea. We now will move on to another important symptom of fever, and let me pass the mic back to Dr. Jaina for continuation of the next box, which will be discussed later by Dr. Chalani.
Thank you, Dr. Ramji. We have now listened to the discussion of general danger sign, then cough and difficult breathing, and diarrhea. The next sign that we have to discuss is fever. As you know, fever box is slightly complicated, so please concentrate on how to pick up the classification, then we will show the video after some time. Dr. Chalani, can you just discuss how to assess fever?
Yeah, thank you, Dr. Jaina. We move on to the box of the fever. As you all know, friends, in all the outpatient departments, the fever is the most important symptoms and the common symptoms along with the other symptoms which we have. Now, to entry to this box is by three ways. That whenever, if the mother says there is a history of fever, or when you feel the baby and you feel the baby appears hot, when you have examined the babies, look at the axilla and feel at the abdomen whether the temperature is high, or when you are actually recording the baby's temperature and you find the temperature is more than 37.5 degrees centigrade. That's the way, I mean, this entry to the box becomes by either route. Even if the baby at the time of examination may not have the fever, but there is a history of fever, then entry to this box becomes mandatory. So now we'll have the video clipping of the assessment process of the fever, and then we'll have the discussion on that. So now this, in the fever assessment, we also decide the other points, whether the malaria risk is high, low or no risk malaria. Now friends, you all know that the high, low or no risk is based on the positivity rate of the malaria. If the slight positivity rate is more than 5% of all the cases of the fever, then it is called the high risk, and if it is less than 5, then it is called the low risk, and if there is no malaria in that area. Now in India, if you know that area of Ladakh is a no malaria risk, but this low high risk malaria is a dynamic process actually. You know, at times there are some areas which are low risk malaria, but in the season of rain or in the breeding, when it becomes high, then the same area can be a high risk malaria. And this information you have with the local malaria officer, who can provide you that this area belongs to low risk or high risk area. So having asked that actually question, then you also find out whether the child has traveled to the malaria risk, high malaria risk in the last 30 days. If suppose the child belongs to no risk, low risk or no risk, then whether in the last 30 days the baby has been to the malaria zone or not. Now having decided that, we will now through the video we'll see how the further assessment of a case of a fever is to be done. So can I have the video clipping on the fever?
Term for fever, or ask the mother whether the child's body has felt hot to her. A child may not be suffering from fever at the time when it is brought before you. However, it is important to know if the child has had fever with this illness.
Fever is assessed because fever in a sick child can be a sign of serious illness, such as malaria or measles. If you do not have a thermometer, feel for fever. Feel the child's stomach or under the child's arm and determine if it feels hot.
Assessing a child for signs related to fever is a two-step process. The child is first assessed for signs of malaria and for measles. And then, if measles is present, for signs indicating complications of measles. First decide the malaria risk. Is there a high or low risk of malaria? Then ask,
For how long?
if the fever has been present for more than 7 days, ask,
Has fever been present every day?
ask,
Has the child had measles in the last 3 months?
next, look or feel for stiff neck.
It's important to assess a child with fever for stiff neck because the child may have meningitis.
First, watch to see if the child bends his neck while looking around. If he does this spontaneously, he does not have a stiff neck. If he does not bend his neck when looking around, encourage the child to bend his neck by drawing his attention to his toes. This is generally more effective than trying to bend the neck with your hand, since many children will automatically respond by tightening their neck muscles.
If the child can look down, almost touching his chin to his chest, there is no stiff neck. If you are not successful in getting the child to bend its neck, you should slowly, gently, put your hand behind the child's head and try to bend the neck. The neck should move easily.
Look and feel for bulging fontanelle. This sign can be assessed only in children who have an open fontanelle. The fontanelle closes in most children by 18 months of age.
Next, look for a runny nose.
A runny nose in a child with a fever may indicate a cold. In a low malaria risk setting, observing whether a child has a runny nose helps to distinguish whether the fever is due to malaria or a cold.
Look to see if there are signs suggesting measles. Look for a generalized rash.
In measles, a red rash begins behind the ears and on the neck. It then becomes generalized. That is, the rash spreads to the face and body. Then the arms and legs. A generalized rash like measles covers the whole body. It should not be confused with a rash like scabies, which is usually found on the arms and stomach. Nor does measles appear just as a rash only on the face or on the scalp.
A child with measles will also have one or more of these 3 signs. A cough, a runny nose, or red eyes. If the child has measles, move on to the second part of the fever assessment. When a child has the signs of measles, it is important to continue assessing the child for signs of eye or mouth complications. Look for mouth ulcers. Are they deep and extensive? Look inside the mouth for mouth ulcers. This child doesn't have mouth ulcers.
But this child does. These are painful open sores on the inside of the mouth, lips and tongue. They may be red or have a white coating on them. Mouth ulcers make it difficult for the child to drink or eat.
Next, look for pus draining from the eye.
This child has pus. Measles can be complicated by an infection of the conjunctiva, or white part of the eye. This can be identified by the pus which collects in the eye.
Look for pus on the conjunctiva, or eyelids, or draining from the eye. Next, look carefully for clouding of the cornea.
The normal cornea is bright and transparent. Through it, the iris and the round pupil at its middle can be seen. A normal cornea allows you to see the color of the iris clearly. The pupil is black. Measles can cause a white spot or clouding to appear in this part of the eye. The clouding may occur in only one or both eyes. When exposed to light, the condition may cause irritation and pain, and the child keeps the eyes tightly shut. Corneal clouding can progress to bad ulceration of the cornea, like this, which can result in blindness.
That completes the assessment process for fever.
Okay friends, so you have seen the beautiful video clipping of the assessment process of a case of a fever. Now here we have seen the assessment of a child, and we have seen the how to assess a child for stiff neck. We have also seen how to assess a child for bulging anterior fontanelle. Please remember, this sign bulging anterior fontanelle will be assessed till the AF is or anterior fontanelle is open, that is up to 18 months or so, and then we have to also assess the child for signs and complications of the measles. Now from here we'll move on to the how to classify. Once we have assessed a child, initially deciding that it is a high risk, low risk and no risk malaria, and then looking for the signs of measles. Now we'll move on to the classification of the this box. So can we have a focus on the chart? Now in the beginning we have to decide whether the risk is high, low and no risk, and from that we'll go on to the classification. Please do not forget to include the presence or absence of the general danger signs which we initially assessed, because this will help you in classification. So if we see the high malaria risk box, and if we always remember the principles of starting from the red, any general danger signs present or presence of the stiff neck or bulging anterior fontanelle, that puts the child into very severe febrile disease. Now which can be either meningitis, which can be encephalitis or cerebral malaria, and they all will be picked up by this classification. Then we move further down. Now in high risk malaria, if none of the sign of the red box is there and there is only the fever is present, and since it is a high malaria risk, we will have the classification of malaria, because the chances of being a baby having malaria is very high if none of the above signs are present. So friends, then we move on to the box of the low malaria risk. Again we starting from the red box first. Presence of any general danger sign, stiff neck, bulging fontanelle will classify same as in the high risk, that is very severe febrile disease. Now if none of the sign is present, then we'll move down and we'll look for the other signs of the fever which we have seen, like running nose, or we have also seen whether the measles is present or not, that is generalized rash is there or not, or no other cause of fever. Now no other cause of fever, where there are some of the causes of fever which we have already assessed, like cough or difficult breathing in the first box. Then we have also seen the diarrhea box, and we'll also be assessing later the ear problem. So if there is none of the fever cause is there, or sometimes you may see the boils or cellulitis is present, because that is also another cause of fever. Then if none of these thing is there, then we'll classify it as malaria. And if we find no signs from the red box or yellow box, and if we see the box of the green, that is if there is a running nose is there, or signs of the measles are there, or we find the baby is having diarrhea or cough or cellulitis or boils, then we'll say that this is fever, malaria, unlikely. That means here the possibility of malaria is less in case of a low risk, and the other causes of the fever, they become important as far as the disease is concerned for that particular child. And then if we move further down in the box of the no malaria risk, again if there is presence of any general danger sign, presence of stiff neck or bulging fontanelle keeps it in the very severe febrile disease. And since here if there is no other signs and the malaria risk is negligible or no, then we will say that fever but no malaria, because here malaria has not been reported actually. So if there are other causes of the fever are there, and none of the signs from the red box are there, then we will classify as fever but no malaria. Friends, initially Dr. Jaina mentioned that this box is complicated, but let me assure you, if you are very systematic and going from the initial asking the question, then looking and feeling for the signs, and then going to the box of the fever depending upon the high risk, low risk or no risk, you will not have any difficulty in classifying these things. Sometimes these boxes, they appear quite big, but you don't have to remember all these things. You having assessed the child, open your chart booklet, look at these things, always remembering the principle of starting from the top red and then going on to the yellow. You will not miss the classification. We will move on to the next classification, that is the box of the measles. Now in the whole assessment of a young infant and older child, you have found two dotted lines. The one dotted line was in the young infant of the assessment of the breastfeeding. Similarly here also in the box of the fever, we have the dotted line, that if there is the child has got the measles now or in the last 3 months, we will look for the complications of the measles. And if we just see the classification of the measles, and again remembering the principle of starting from top, any general danger signs present, presence of the clouding of cornea or deep or extensive mouth ulcers, the classification is a severe complicated measles, because we all know that deep extensive mouth ulcers, they again become the severe illness, and the baby has got difficulty in taking feeds, and this baby has to be referred to the hospital. And if none of the signs is there from the red, then we move down, that is if pus draining from the eyes, or there are mouth ulcers which are superficial mouth ulcers are present, this becomes the measles with eye or mouth complications. And if none of the signs are present from the red and yellow, then we will classify this as measles. So friends, here we have seen how we classify a box of the fever. We have taken into consideration the severe illnesses, we have also taken into consideration the malaria, and we have also seen the classification of measles. But you must be thinking that there are other causes of the fever also, but we have not missed them. In the assessment we have already done for cough or difficult breathing, we have already assessed for pneumonia or very severe pneumonia. Similarly, the fever, as we have said, can be because of diarrhea, so diarrhea box has also been done, and we'll also coming down to the ear problem. And if you find that if the child does not fit into any of these things, then there is a last column which we'll be talking later, is the assess other column, assess other problem. So we are not going to miss any cause of the fever in this, but in this broadly we have taken up those causes which have got the maximum morbidity and mortality. So that's how you will be assessing these children. Over to Dr. Jena.
Thank you, Dr. Chalani. As you know, after the fever box, we will be assessing the ear problems. Not only ear problems, then there will be compulsory box like checking for malnutrition, checking for anemia. So all these things will be discussed by Dr. Prasad. Dr. Prasad, please.
Thank you, Dr. Jana. Friends, you have finished the major chapter of fever, that is the biggest chapter. So very small boxes are now left, and boxes of ear problem, malnutrition, anemia, check for immunization, assess other problems. Now ear problem is concerned, this is an optional box. You enter in this box only when mother complains of any ear problem. But malnutrition, anemia, these are the compulsory boxes where you have to enter as a routine. So before I discuss further, I think you should watch the video. Can we have the video on this, all the three problems combined together?
In this section, we will see how to assess for an ear problem and then check for malnutrition and anemia. Ear infections rarely cause death, but they are the main cause of deafness in developing countries. An infection can spread from the ear to the brain, causing meningitis. To assess for an ear problem, first ask the main symptom question.
Does the child have an ear problem?
If the mother replies that there is an ear problem, assess the child further. Ask.
Is there ear pain?
Ask.
Is there ear discharge?
If the mother says yes, ask.
For how long? Ear discharge is a sign of infection. The duration of the ear discharge is important when deciding whether to treat the child for acute or chronic ear infection.
Next, look for pus draining from the ear. Look closely into each of the child's ears. Next, feel for tender swelling behind the ear. You should feel behind both ears like this to determine if there is tender swelling of the mastoid bone. The mastoid bone is the large bone behind the ear.
Tender swelling behind the ear may indicate a deep infection of the mastoid bone. Both tenderness and swelling must be present to classify mastoiditis.
That completes the assessment for an ear problem. The health worker would classify the ear problem.
Check for malnutrition.
It is very important to check all sick children for signs suggesting malnutrition and anemia. Look for visible severe wasting.
To look for visible severe wasting, remove the child's clothes. Look for severe wasting of the muscles of the shoulders, arms, buttocks and legs. The hips look small compared to the chest and abdomen. Look at the child from the side to see if the fat of the buttocks is missing. A child with visible severe wasting may still have a normal appearing face and a large or distended abdomen. This child has visible severe wasting. A child with visible severe wasting has marasmus, a form of severe malnutrition.
Next, look for edema of both feet.
To determine if a child has edema of both feet, the health worker uses her thumb to press gently for a few seconds on the upper side of each foot. If a dent results in both feet, the child has edema. This child does not have edema. Edema is an important sign of kwashiorkor, a form of severe malnutrition. This child has kwashiorkor. This child has edema. The edema or swelling is due to an accumulation of fluids in the child's tissues.
If the child has not already been weighed and his weight recorded during this visit to the clinic, the health worker weighs the child.
A child's weight for age is another indicator of malnutrition. A child with a very low weight is malnourished. He needs to have his feeding assessed. Determine the child's weight for age using a growth chart.
Check for anemia.
Look for palmar pallor.
Pallor is an unusual paleness of the skin and is a sign of anemia. Children with severe palmar pallor have severe anemia. To see if a child has palmar pallor, look at the skin of the child's palm. Hold the palm open by grasping it gently from the side. Do not stretch the fingers backwards. This may actually cause pallor by blocking the blood supply. Compare the color of the child's palm with your own palm, or with the palms of other children. This child has severe palmar pallor. The palm is so pale that it looks white. This child has severe anemia. If the skin of the child's palm is pale but not white, the child has some palmar pallor. This child's palm is normal. It is a healthy pink color. This child has severe pallor. Anemia occurs in children who are not eating foods rich in iron, or who have malaria, hookworm, or whipworm. Severe anemia can be life-threatening.
Next, the health worker checks the child's immunization status. Assess the child's immunization status. Decide whether any immunizations are needed today and when the child should come back to the clinic for their next immunization. If the child is well enough to go home, the child should go home with his immunizations up to date. Finally, assess any other problems the child has. This completes the assessment of the sick child, aged 2 months up to 5 years.
Yes. So you have seen the video of the ear problem, anemia and malnutrition. Now we will be having discussion after the tea break. We will have tea break for 15 minutes. We will be meeting again at 1:05. Please be with us.